Hello, my name's Sue Karen and I'd like to welcome you to today's NSK podcast in which I speak with Sami Stagnell, who is a specialist oral surgeon and has an MSc in restorative dentistry. Sami was one of the first clinicians to be made a Fellow in Clinical Leadership and Management with Health Education England and has led a very interesting career which I'm eager to learn about.
So day-to-day work, predominantly as a specialist oral surgeon, I chose to work in primary care just because for me it struck a better balance for work life. But oral surgery was always a passion. It was always something interesting, and I sort of when I was doing work experience, even before I became a dentist, I sort of came across implant dentistry and oral surgery, and it was just for me eye-opening, and it really blew my mind that this was what dentists did. One of the first lectures I had in my third year, I went up to the oral surgeon giving it, and I told him that one day I was going to be an oral surgeon. And funnily enough, we now work together. So, and he still sort of pulls my leg about the sort of the wet behind the ears guy who harassed him at the end of the lecture. So, but it was, I think it's largely, as much as anything else, good people, that as well as a good clinical specialty, and that, you find your place in that cohort as much as anything else. And that's been a big part of it.
Yeah. No, good to have ambition from an early age, isn't it? And to, I think.
Yeah.
So you've also got an MSc in restorative dentistry along with your specialism in oral surgery. So that really brings together, those two aspects of dentistry. I mean, it's perhaps not an unfair question to say which do you enjoy most, but why did you go off having got the oral? Presumably,
well, I think you can't have one with the art. You can't have one with the other. And I actually started with the MSc first because I did that before I got onto specialty training, because I didn't know when I might become a specialist, and I sort of wanted to, if I was going to be in general practice, I wanted to be able to do it to the best of my ability. So I ended up doing a degree which I thought would complement me as best possible, and actually then sort of just played in favor in my ignorance to actually towards the implant work, because implant work is not just surgical, it's very much restorative, and without knowing or understanding it, I couldn't do it. And it actually, I think it made me a better oral surgeon, a more understanding oral surgeon, because otherwise, there's these classic jokes about surgeons who just, put implants in where bone is and don't consider where the tooth is going. And I really didn't want to be the stereotype. And so having that really helped. I'm certainly not an expert, but it definitely sort of changes, how you view things. So.
Yeah, I think it does, doesn't it? If you understand the sort of how it should end up looking like a tooth, as opposed to just, as you say, slugging it in any bit of bone. I think it makes a big difference, doesn't it? Really, to the actual patient outcome at the end of the day. Isn't it? It's going to be much better.
Yeah. On top of that as well, I think this is kind of, I know, but it lends you to a better patient experience, because patients often, when they come and see an oral surgeon, it's because the tooth is on its way out. And if you have an expectation or an anticipation about what's feasible in general practice and what can be done or should be done, then you I think the patients are happy, because you can have more holistic conversations with them, and you can think like a generalist. I think being a generalist is actually one of the hardest jobs around. I don't think it's easy to be a general dentist at all, because you have to be such a polymath to do it. But if you have some idea what they're going through and what is and isn't right, you give people better, I think, options. You create better discussions and conversations with people around what it is they're having done.
Yeah, no, definitely. And obviously then that leads, because of your understanding and your training, that leads to ultimately better patient outcomes.
That's it.
Yeah. Okay. So can we talk in general about use of piezo units, and then could you talk to me about which of the NSK products that you do?
Yeah, sure. So piezo is something that I came across by accident, because I think traditional training and things like oral surgery is drill and fill. It's like in the rest of dentistry, you have things that we've always used, and that's it. And it's one of those things that you kind of hear about but don't really ever get to see. And I sort of had one planted across my sort of path, and was told, give it a go, see how you get on with it. and the experience was so good. And it's still, and I think I remember hearing a long time ago, that if you have a hammer, everything looks like a nail. And I think it's really easy in dentistry to get waylaid by, a new fad or a gimmick that sort of is meant to solve all your problems. And there's no one thing that does, but there are some things that make your life easier, definitely. And piezo is one of those things, because it's opened up the ability to treat people in a safe way, because it's just another tool in the toolbox. Patients are more comfortable with it. It's simple to use. It does drag things out a bit more, can be more time consuming, but there's a safety element that comes with it. And if you have certain risks in certain patients, you can approach them much more conservatively and safely. And so it's a no-brainer to sort of have that sort of kit in your practice, because it just enables you to sort of to approach patients with a much more specific or bespoke approach, just because you've got that extra thing in your back pocket. But as far as equipment go, and just generally with like NSK equipment, the reason I use NSK is just its dependability. I've been using it for well over a decade now, and it's just always good. There's loads of other brands out there, and they all do a good job, a lot of them, but NSK is just brilliant, and it doesn't break down, it doesn't fault me in any way. I use a lot of the thinner surgical straight hand pieces, which are much lighter, simpler to use, more agile when you're in the mouth. And I'm also a big fan of their drill decks are fantastic, because they can be customized in so many ways. And again, really just simple to interpret and manage and maintain on a day-to-day basis. And we've got dozens of them across our NHS contracts. And they don't break down, they don't go to fault as easily as others that I've come across. And that in itself is hugely important when you're treating 15 patients a day, 5 days a week in some of these surgeries, surgeries. So that's a big part of it. And then I also have some of the reverse flow surgical fast hand pieces, which again, brilliant sort of get out of jail cards. And they have their place, they have their time. And I used to carry one with me as a sort of backup, just because it was quite useful to have when you were going into a practice. If I was going to different places that didn't always have surgicals, or I didn't think I'd need a deck and bring everything with me, it was much easier to sort of bring with you and sort of adapt to what you were doing there and then. So this kit is it's well thought through. It's thought through with the end user in mind, and that's a huge part of it.
So when you say deck, you mean the actual surgical drill, the Surgic Pro?
Yeah, the Surgic Pro.
Yeah. Okay. Just to be clear, Yeah.
Yeah. No. Yeah.
Yeah. Okay. No, that yeah. Because I mean, an awful lot of people have got them, haven't they? And I know people get them with implant systems and all the rest of it. And a lot of people say how reliable they are. That they're very, very reliable. And you're right. That reverse exhaust handpiece is a nice bit of kit, isn't it? It's very useful piece of equipment.
Usually,
yeah.
Sometimes with surgical work, you can actually be more conservative than destructive if you use the right kit in the right place. And that reverse flow handpiece is definitely that, because you can if you haven't raised flaps or things yet, and you just want to section teeth simply and quickly, it does it so smoothly and quick. It's unreal.
Yeah, great. And I don't know if there's another. I mean, I'm not. I think it is unique, isn't it, on the marketplace? I don't know of another.
It's pretty. Yeah, it is. I mean, I there's no other that I've come across that sort of does it the way that it does. So
yeah. Okay. Great. And in terms of I don't know how much support you get from NSK, but do you get a reasonable amount of support from NSK?
Yeah, we have our service contracts with NSK for all our surgery contracts, and they're fantastic. And I've been working with Mark and Alex for a long time now, and they're just such approachable people. They're easy guys you can sort of talk to in any arena in any way, and they just there to help. They're just never too much. They're always just interested in what you have to say and how they can help. So they're thoughtless in that way.
Yeah, great. Yeah, I mean, obviously I've interviewed lots of people, and most people say, well, everybody I've ever interviewed always says the same. To be fair, so yeah, it's across the board. You were one of the first clinicians to be made a fellow in clinical leadership and management with Health Education England. What did that mean to you, and what does that involve and mean?
Yeah, sure. So I mean, leadership is one of those buzzwords that sort of gets bandied around quite a lot. And I think medicine was very quick to adapt this concept that leadership is a set of behaviors. It's a mindset as much as anything else, not a job title. And medicine was very quick to include fellowships and build on opportunities for clinicians, especially in training, to go and get experience rather than the traditional way of sort of climbing a ladder and becoming a leader by virtue of the sort of the job role that you hold, and how big your office is. The idea was about creating good habits in people from early ages, and that they led within their teams, ecosystems, component of what it was in dentistry and KSS, as it was the old deanery at that stage. They sort of set these opportunities up so that we could effectively work in higher level organizations and get experience working with sort of commissioning and in those sort of realms, because it's a whole new language, it's a whole new way of thinking and working. And even though they've been involved with the BDA and groups like that beforehand, this was service delivery and commissioning at another level, and it, you learn project management and sort of the behaviors you need to operate in those levels. So it's super important, because clinicians are being given more responsibility in how services are designed and how things are implemented. And I think if you can communicate with these groups on their level and understand the way they think and behave, it's hugely important. But then also that trickles down, because leadership behaviors are important for how you run a practice and how you run a team and how you interact with other human beings. And the team, the idea of things like flat hierarchies, where everyone has their own important role depending on what it is that they're doing, but everyone is equal in the larger perspective. It breaks apart the way that I think the traditional practices were built. And for me, it's all about you work with humans every day, so make that process as entertaining and easy as possible, really. So yeah, it was a really great opportunity. Blew my expectations in comparison to what I even thought it might even entail, but it certainly changed the way I thought, the way I behaved. So
excellent. Yeah, that sounds really interesting. And presumably that was how long did it take you to sort of go through that program then?
So I was in that for 18 months in all, and I did a postgraduate certificate in healthcare leadership and commissioning with Brighton University as well at the same time. So yeah, so I got lots of academic, lots of theory, and then lots of like real world practical experience on top of that. So
yeah, no, great. No, it sounds good, doesn't it? And it's very nice to be, as you say, having the opportunity to work in a modern management system, as opposed to, as you say, that that traditional sort of pyramid,
exactly,
which it all worked out doesn't really work very well, does it?
Yeah, exactly.
On lots of occasions, just because you've been there the longest doesn't necessarily mean you're the best.
No, exactly.
You can lead people. You also, because NSK have been involved with dentek, and I know I've given some equipment to dentek, but you're also a trustee of dentek, I understand. So what's your involvement with dentek and sort of?
So I used to contribute to the Crisis at Christmas movement, and that was happening up until recently. And I was really lucky to be involved in that and really enjoyed it. And a few years back, dentek got involved. Dentek was set up initially to fill a gap in the market, which was provision of dental laboratory services alongside a lot of the dentistry that was going on, because there's loads of really great dental charities, but ultimately their focus is on clinical dentistry rather than the laboratory side. And so dentek sort of came around to compensate for that and to contribute and it creates some balance in this. And they were helping us do dentures and simple prosthetics for Crisis at the time, and went down absolutely brilliantly, because it was a massive missing piece of the puzzle. And it was so well received. It was brilliant. But Andrea Johnson, who heads it and started it, is just a brilliant person and sort of so thoughtful and considerate and outgoing and out of the box. It was sort of, she was just a breath of fresh air in so many ways. And then she asked for some clinical support with the charity, because they were all largely lab techs and wanted input from other perspectives. And that was how I first got involved with it. And then I was really fortunate they asked me to sort of step in as a trustee to help sort of steer some of the direction for the charity, which was really a massive honor. And and in doing that, we've sort of started to build on the projects that we've got going on. So we've been working with the Southampton Veterans Centre, for example. So there's loads of stuff that we've sort of started to do, and the ball is rolling. And obviously, with COVID, things have taken sort of a bit of a backseat and slowed down. But with lots of ambition to sort of grow what we're doing with the charity and to complement the work that's being done out and about in the rest of the system, really. So it's definitely one to watch.
Yeah, no, it's good, really good. And presumably the vast majority of their work is in the UK, isn't it? They don't do anything.
Yeah, it's all in the UK. It's all in the UK at the moment. Predominantly, we have some projects that are abroad. We've been looking at projects in Cambodia and one in, oh God, I've just forgotten. We have a project in Africa and it's gone out of my head. I will come back to you with that, just probably in our So we have some projects abroad, because we did some projects. I think originally Andrea was involved in some bridge to aid work in Rwanda, which was how this sort of came about. And that was why this got started. So we have other work elsewhere, but predominantly our focus has been within the projects at home. Is where we see a big need for it as much as anything else. But yeah, we have ambitions to take this and the concepts beyond and bigger. So absolutely. And obviously, we've got NSK to thank. You mentioned the stuff that they've gifted us. They've gifted us some brilliant kit. You can work with old tatty equipment, or you can work with the best of the best, and that's what NSK has allowed us to do. It drastically improves what we can do and how much we can do just by having sort of better and more reliable equipment that we can sort of deploy much more easily. So
definitely. I'm involved with, this is a complete aside, I'm involved with a homeless charity in Lincoln. Somebody I know runs it, and
okay, lovely.
I don't know whether perhaps I should contact Andrea and see whether there's some help that they,
Yeah, please do, because we're looking at opportunities to link the charities, because that's part of it, because it is very simplistic in some ways. So the ability to sort of couple up with others is really, where we want to take things, because it's about collaboration and synergy, I think.
Because I know that they've struggled. I did put them in touch with somebody around dentistry for because they were really struggling to find a local dentist that would actually see these people.
Yeah.
And actually I did manage to sort of connect them with somebody that would see them, but yeah, it would be good to be able to link them up with you guys, I think.
No, brilliant, thank you.
That's the question. What has COVID done to you, and how has it impacted your day-to-day life, and what are your thoughts about what the future might look like?
Well, I think the key thing is that it's not affected anyone. Everyone is in this together, and I think the minute you start to think you're on your own, it's you're in a losing battle. I think you have to keep perspective on all these things, and very lucky because healthcare isn't going to, where lots of people have lost jobs and resources, whereas what we've got is stability in terms of client base and a need. So I think it's clear that the workload is growing. We're not going to run out of work. Our referrals have gone up in every direction, and I think it polarized a lot of things for a lot of people. People sort of took decisions during the first lockdown about what they saw important, and a lot of people made decisions about their health, and that's sort of pressed a lot of people on, which is useful. But I think we're lucky to do a degree in oral surgery, and that it's not been classified necessarily as an aerosol generating procedure. So we've been able to resume things relatively straightforward. I think, if you've ever worked in theatre environments and things, you're used to wearing gowns and the rest of it. So you just get on. I think for me, it's about expressing gratitude to the fact that we've got the ability to work, and there are processes in place, but processes were disrupted in the 80s when HIV happened, and those processes the legacy of what that ended up with is what we call day to day up until a year and a bit ago. So I think this might influence things, but in no way we'll come to find it normal. And as long as I think the people in the right places recognize the real struggles day to day on the ground, and are human and empathetic and sympathetic to those, and make decisions that are considered, we'll all get through this, and dentistry will sort of strive. But I think change is inevitable, and acceptance of change is necessary. So it's getting comfortable with the fact that the change has to happen, and we can only influence so much.
Yeah, I think you're right. I think we are very, very fortunate to be in a profession but I do think it was wrong that the government sort of stopped dentistry in the first lockdown. Really, I think, with the benefit of hindsight, we've all got hindsight now, haven't we? So,
Well, that's it. Yeah, and I think that someone said early on in the first lockdown, I remember, like, the only thing that will teach us anything is history, and it's so obvious and so true. In 10 years, when we look back and we run, movies about this and whatever else, it'll be something that we talk about and tell the kids, and but that's it. There's no other way to be that wise in the moment when there's so many unknowns, and I think that's part of it. I think it's very simple to cast, but I'd challenge anyone to do it sort of differently and better. There's always room for it. There's always room for improvement,
Yeah.
and it's just, I think, maintaining some pragmatism.
I mean, I think you're right. You made the analogy between COVID and AIDS, and although they're very different. I mean, I lived through that, and I remember what it was like. And I think, and obviously, it didn't ultimately impact all our lives at that point. But there were, it was very strange times, weren't they? And people were very frightened and scared about what was, and as you say, a lot of procedures changed for the better because of that, and we came through it. So I'm sure COVID will be the same, won't it? And it's certainly given us all plenty of time to think about things, which
exactly.
Which I think has been probably beneficial to us all in some shape or form. Thank you very, very much. Take care.
Thank you. You too. Bye now.
Bye. I'd like to thank Sami for his time today and his interesting thoughts. If you'd like more information about NSK UK and the equipment that they offer, please visit mynsk.co.uk.